Hi, everyone. Thank you for joining today. My name is Kim Myers. I'm a community outreach specialist at the Brain Injury Alliance of New Jersey, and today's presentation is about Introduction to Brain Injury. So today we'll discuss the different functions of the brain. We'll define brain injury and talk about all the different levels of severity. We'll discuss prevalence and all of the different causes that may lend themselves to brain injury, and then identify changes that may occur after a brain injury, and then identify strategies to help individuals with brain injury if they do sustain one. And lastly, we'll provide a brief overview of our programs and services at the Brain Injury Alliance of New Jersey. So the brain controls everything we do. It controls our breathing, walking, talking, thinking, behaving, and our feeling. It even controls our social life. It helped us make coffee this morning. It helps us look out the window at this rainy day. It helps us to breathe, to eat, even to sleep. So it really is in control of every single thing we do throughout our day. Some other functions, so for example, the frontal lobe is in control of initiation, judgment, motor planning, even personality. So all of these things can be impacted if someone sustains a brain injury. And the frontal lobe is the most commonly injured part of the brain. Temporal lobe might be memory, might be hearing, expressive and receptive language, and then other things like musical awareness, organization. So as you can tell, each part of the brain is responsible for different functions, but they all do work together. So just the definition of brain injury: a brain injury is not congenital, degenerative, hereditary, or induced by birth trauma. So it is not Parkinson's, it's not Alzheimer's, it's not any brain disease. It's due to a trauma after birth. So it may be an internal trauma, like a stroke, or it may be an external force, like a car crash. There's two main definitions of brain injury. There is acquired brain injury. This is non-traumatic, so this is more of an internal event. This could be due to a stroke, a brain tumor, an aneurysm, a seizure, any sort of internal event that occurs. Then there's also traumatic brain injury, which we normally think of when we think of brain injury, and this is more of a blow to the head. It could be a physical hit. It could even be an acceleration, deceleration force, like a whiplash. So some examples of acquired brain injury include lack of oxygen. This could be due to strangulation or due to a near drowning experience. It may also be due to strokes or aneurysms. So whenever the brain tissue does not get the blood flow and oxygen it needs, it can cause death and injury to the brain tissue. Infections to the brain like meningitis, encephalitis, even COVID now, they're finding long COVID may be injury to the brain. Also toxic exposure, which may be alcohol, it may be poisons, maybe overdoses can cause brain injury. And then also any sort of medication overdose, right? So if someone accidentally takes too many doses of their medication, it may cause brain injury. Seizure may cause brain injury, and then also electric shock. This interferes with the electrical signals between the brain cells, and tumors due to pressing on that brain tissue. It may not allow it to get enough oxygen. Some examples of traumatic brain injuries include motor vehicle crashes, falls. So falls are the #1 cause of traumatic brain injuries, especially for those over the age of 65, maybe due to assaults and violence, including domestic violence, sports and recreation injuries like concussion. So concussion is a type of traumatic brain injury. It's considered a mild traumatic brain injury. And then also military and blast injuries may cause traumatic brain injury. Workplace injuries, especially those in the construction trades, like roofers or framers. Acceleration, deceleration forces may also cause it. So how I like to picture this is picture a raw egg, and that yolk inside is our brain, and that hard shell is like our skull. So if you shake a raw egg, that yolk is going to hit against the insides of that hard shell, and same with our brains. And unfortunately, our skull has all these really bony ridges on the inside of it. So if our brains hit against these ridges, it can really damage it. So there's 3 different severities of brain injury. We have mild, moderate, and severe. So for mild brain injury, someone may experience dizziness, vomiting, loss of consciousness up to 30 minutes. They may experience memory loss or fatigue. So this is basically a concussion. So a concussion is a mild brain injury. This is not present on imaging, so it won't show up on MRIs or CAT scans. And there's also moderate brain injuries. So someone may experience contusions, bleeding on the brain or in the brain. They may be unconscious from 30 minutes for up to 24 hours. And then there may be signs of brain trauma on imaging like MRI or CAT scan, but not necessarily. And then there's also severe brain injury. So an individual who sustained severe brain injury may experience unconsciousness for more than 24 hours. It could be several weeks even. They may show signs of injury on neuroimaging tests. So more often than not, a severe brain injury will show up in some way on neuroimaging. And then they may experience post-traumatic confusion or amnesia. They may not remember what happened during the incident or before the incident or even right after the incident. So we call brain injury a silent epidemic. An estimated 5.3 million Americans live with a disability as a result of traumatic brain injury. So it's really significant. And we also call it a silent epidemic because it occurs in such large numbers, but you can't see it. So unlike a broken bone, like a broken leg or broken arm, you can't tell that someone has a brain injury just by looking at them. So it's almost an invisible injury in that way as well. So TBI statistics, so 611 people are hospitalized every day for TBI in the US. There's 176 deaths every day. And then the most hospitalized and deaths are individuals who are 75 plus in age. 15% of high school students sustain a concussion each year. So that's also a pretty remarkable number. And it's similar for middle schoolers as well. It's a pretty high statistic. So some leading causes of brain injury, as I mentioned before, number 1 is falls. Number 2 is motor vehicle crashes. Number 3 is assaults, and that includes domestic violence. And then number 4 is unintentionally struck by or against an object. Brain injury is unpredictable in its consequences. So just as every individual is unique and different in their own ways, every individual sustains a brain injury in different ways or is different prior to an injury. Every single brain injury is different. So we like to say, if you meet one person with a brain injury, you meet one person with a brain injury, right? Because everyone handles it differently. Everyone's experiences different symptoms. Everyone adjusts differently. So some effects of brain injury, like I mentioned before, since we use our brain for everything we do, it can affect every single thing we do. It can affect our physical life. It can affect our cognitive function, our emotional behavioral function, even our social functioning. So we often hear from people that sustained a brain injury. They might say, they're losing friends because their personality changed as a result of the brain injury. So they may feel like their friends are distancing themselves, their family is distancing themselves. So it can really affect every single part of our lives. If we think about what we did this morning, we got up and made the bed, maybe we drank coffee, maybe we made ourselves breakfast and got ourselves ready to go to work. So all of these things require brain function, and this may be really, really difficult for someone who has a brain injury. So some physical changes that can occur if someone sustains a brain injury are fatigue, loss of smell and taste. They may have hearing loss, they may have visual problems, even sleep disturbances, both sleeping too much and not sleeping enough. Balance and coordination issues, which may also lead to a second traumatic brain injury if they have a fall risk due to balance and coordination issues. They may have slurred speech, poor motor control, again, can contribute to further brain injuries. Seizures, decreased tolerance for drugs and alcohol. So individuals who sustain a brain injury may be extremely sensitive to drugs and alcohol. So they may have even just one drink and then really be pretty incapacitated because their brains are so fragile in that healing state that they might not be able to handle it the same way as they used to. And then also headaches is a very common symptom. And cognitive changes can be memory loss, lack of initiative. People may have issues starting to take on projects, which can affect their work as well. They may have impaired reasoning. They may have impaired visual or perceptual skills. So it can affect all of our senses, like I said, our seeing, hearing, even tasting. I know of someone who sustained a concussion and they lost their sense of taste. And also someone who went colorblind due to concussion. So all of these things are possibilities. They may have issues processing and understanding, communication in general, both understanding speech and formulating speech, and attention span may be altered. They may have issues planning and organizing, which again can affect work, it can affect school. Completing tasks may become difficult, and also they may have diminished insight and empathy. There's also some emotional and behavioral changes that may take place, including impulsivity, emotional ups and downs, maybe irritability, decreased frustration tolerance also goes hand in hand with that. And it can make it really difficult to get tasks done during the day. Someone may experience impaired judgment, or anxiety, depression, mental health difficulties are really, really common for individuals who sustain brain injuries. They may experience aggressive behaviors, changed sexual drive, or changed personality, like I mentioned before. So this is just a short video that shows how difficult it can be for someone with a brain injury to navigate some basic tasks in life. And hopefully you'll be able to see some of the symptoms in this video.
I wake up. I turn off the alarm. I look outside so that I know what to wear. I take a shower with soap. And then I shave. Sometimes I cry for no reason. But I'm getting a handle on it. I wake up. I get dressed. I take my meds. When Lewis is gone, I make the coffee, which can be tricky. I eat breakfast, but I don't read the paper. It confuses me, which makes me mad. I wake up. I put on my coat and go to class. I wake up.
Seconds. You're just doing one day, okay? No big deal. And time. It's okay, Chief. It's not a test.
So injury severity doesn't necessarily determine symptoms or outcome. This is really important. So someone may sustain a really severe brain injury and recover pretty remarkably fast. And someone may sustain a mild brain injury like a concussion and take many months to recover. So things might not return to the way that they were before the injury. Some people, when they think of recovery, they think of things being completely back to normal the way it was before they sustained the injury. But this is not necessarily the case. So things might not ever go back to how they were before the injury. And rehabilitation can be a really slow process. Many individuals find it frustrating how slow this process can be. So there is also long-term impacts of brain injury. It can impact someone's family and social life. So like I said before, they may lose friends due to change in personality. Maybe they can't reciprocate the friendship in the same way. Maybe their interests and hobbies have changed, or they're not able to participate in their interests and hobbies. For example, if someone has friends who are on soccer team and they're all on the soccer team together, after the brain injury, they cannot play soccer anymore. That would be less time with friends and can affect that social life. Vocational and school it can affect. So if someone's not able to pay attention in the same way, if someone is not able to gather thoughts in the same way, this may impact their vocation or their schooling. Can also affect financial life. So if someone is affected in terms of their career or job, it can affect them financially as well if they don't have a steady income coming in. And then for the same reason, it can affect housing. If they're not able to pay their mortgage or pay their rent, many individuals with brain injury, or some individuals, I should say, do end up in homeless shelters due to not being able to pay their rent or mortgage. And then recreational, it can affect. So like I said before, they might not be able to participate in the hobbies they love to do before. And then this can really lead to trying to rediscover themselves. Many people with brain injury need to kind of start from the beginning and rediscover who they are as a person because they've changed so much. And then also it can affect transportation. So many people can't drive after a brain injury. They may not be able to access public transportation either, depending on the area they live in. They might not have access to buses or trains. So this can really be an impeding factor. There's also psychosocial consequences. So there's interpersonal difficulties. Like I mentioned before, they may have issues establishing and maintaining relationships. Due to the brain injury, they may feel as though their social skills are not the same as before. They may not be able to communicate in the same way as before. Again, both understanding and gathering speech. Their intimacy and sexuality may affect their relationships if they have changes in drive. And then also substance use. So many people with brain injuries do turn to substances in order to better deal with their injury as a coping mechanism. They may also have more access to medication due to their injury. So all these factors put individuals who have sustained brain injury at a higher risk of substance use. And studies do show that individuals, especially those individuals with a past of substance use, are at much higher risk of taking that back up after an injury. There's also interpersonal difficulties. So someone may have loss of self-esteem. They may have a really shaken sense of self. Like I said before, they may have to rediscover who they are as a person all over again. They may feel really depressed or frustrated or have those mental health symptoms. And then they may also experience a profound sense of loss. So individuals with brain injury have many, many different types of loss. They may experience loss of freedom, loss of individuality, loss of sense of self. They may have loss of friends, loss of family, and then also loved ones of individuals with brain injuries. The support network may also experience sense of loss. So some strategies for communicating with individuals with brain injury. How can you help? Number one, become more knowledgeable about brain injury, right? Learn more about it, what the symptoms may look like, how someone may help themselves recover from brain injury, what professionals they may be able to see. And then also become knowledgeable about appropriate resources. If there's any resources in the community that might help them. And then also offer understanding and support. Just being there for them as a helping hand or a shoulder to lean on is really important. And then number three, providing appropriate assistance and accommodations. So for example, a child in school who has sustained a brain injury may need different accommodations like extra time on tests, extra time to hand in schoolwork, may need instructions written down versus verbal instructions. All of these different things can be accommodations to help individuals. Some other strategies are to speak slowly so that you know that they're getting information and understanding what you're saying, being concrete versus using metaphors. Many individuals who have brain injury, especially moderate to severe brain injury, need that information to be concrete versus metaphorical or sarcastic. I spoke to an individual who had said that he was not able to process sarcasm or understand sarcasm. So just being concrete is important. And then also breaking information into smaller pieces versus a big chunk. So rather than giving someone a whole text, a paragraph of instructions, you might want to just break it into little bullet points in order for them to fully understand and remember it. And then also encouraging visual reminders and checklists is really helpful. So one reminder might be on someone's phone. They might set an alarm for a certain time every day if they need to take a medication, and then check it off once it's done. And any sort of reminder that they might need can be done through these alert apps like that. And then also repeating information. So some individuals might need information repeated multiple times in order to remember it. So just repeating it as many times as they need instead of getting impatient. Some prevention strategies include walking and driving safely in the community. So one of the primary causes of TBI are car accidents and pedestrian accidents. So always making sure that when we're walking at night, we're wearing a reflective vest. When we're biking, we have lights on our bikes. When we're driving, we're very, very aware of our surroundings. And then of course, also not driving or walking or bike riding distracted. So not being on our phones when we're doing any of these activities, not wearing headphones, making sure that we can see and hear everything in our surroundings at all times. And also using safety equipment, always using seat belts, even if we're in the back seat. Always using reflectors, like I said, when walking or biking in the community. And then also always wearing a helmet when we're biking. And playing sports according to the rules. There's many rules that are in place to help protect you. So making sure that you're following those. And if you feel as though you may have sustained a concussion when playing sports, always making sure to sit it out until you're sure. So we say, when in doubt, sit it out. Then also exercising caution and being aware of your surroundings. So just bottom line, always being aware of your surroundings, especially when you're in public, when you're driving, walking, biking.
Do you know what a concussion is?
Sort of.
Banging your head on something.
I don't know.
And your brain kind of moves a little bit, and then I think you pass out.
Or they were bleeding.
A cast, not really a cast around their head, but sometimes they can have like those things that like wrap around your head.
Put ice on it.
They probably hold up numbers, and you probably test it.
Yeah, so you need to be very, very tough to play through concussions.
Why are they tough?
Because they had a concussion and they get back up and play.
And you had a coach that wanted you to keep playing. What would you do?
Keep playing and try my best.
So our goal, like I said, is to educate the public, including educating children, and then also raising awareness among those most at risk. So this is seniors, our older population, 65 plus. Those who use substances such as drugs and alcohol are also at a much higher risk for brain injury. Then also those who have brain injury are more at risk of substance use. So there's a bi-directional relationship there. Victims of violence are more at risk of brain injury. Like I said, domestic violence often results in brain injuries, either due to hits to the head or due to strangulation. And then also those engaged in sports or risky physical labor may be at higher risk, such as those in the construction trades or those in sports, especially contact sports like football. And then also service members are at higher risk due to those blast injuries. So just going to go over some of Brain Injury Alliance's programs and services very briefly. So we have direct services, we have education, prevention, and also advocacy. So some of our direct support services, we have case management programs. I should mention also everything we do is free since we're a nonprofit. We have case management programs, we have a helpline. So this is more of like a warm line, so it's not a hotline, it's not an emergency line. So if you know someone who sustains a concussion, they can call this helpline and we can help assess their quality of life and figure out what services they need and then help set them up with what they need. And then there's support groups that we have. They're both virtual and in person across the state. And we have support groups for caregivers and also groups for survivors. We also have Camp Trek, which stands for Together in Recreation, Education, and Knowledge. This is coming up in 2 weeks, and it is a week-long summer camp, sleepaway camp for adults 18 plus with brain injuries. And I also like to give a shout out to the TBI Fund in New Jersey. So this provides New Jersey residents who have survived a traumatic brain injury, specifically traumatic, the opportunity to access the brain injury related services and supports they need to live independently. So there are some eligibility criteria. So an individual must provide medical documentation that they sustained a traumatic brain injury. They must be a resident of New Jersey, and they must have liquid assets of less than 100,000. And this is a fund that can provide, I believe, up to 20,000 per year for services that can help the individual live independently. And we also have an education branch. So this includes webinars. We have about 1 webinar a month. on different topics related to brain injury. We have different workshops like the one you're attending now. We have regional trainings twice per year, both in the spring for professionals. And this year, our theme is going to be children and childhood and how brain injury may affect the development process. And then Family Fest is our event for families that we have every year, and that's also in the spring. Last year, we went to Turtleback Zoo, so we may be doing the same thing this year. Stay tuned. It's always a fantastic event. We also have prevention and advocacy. So we have a Champion Schools program where kids come up with a safety PSA or ad or video, and then there's a competition, and then they can win cash prizes. And then there's also Jersey Drive's web page that talks about safe driving, safe walking, being a safe pedestrian, and biking safely. And then there's also Share the Road campaign about sharing the road safely with motorcycles and cars. And we also have a legislative network, so we try to push through legislation that has to do with protecting individuals with brain injuries and providing those services. So we do have some social media channels. We have a Facebook, Twitter, YouTube, and Instagram, and our website. And on our website, you can find more resources about brain injury, including prevention and recovery. So thank you so much. This is my colleague's information, but I'll provide my information as well. Again, my name is Kim Myers. I will put my email in the chat if anyone has any questions at all.